I'd like to talk about some of the approaches that people can use in order to optimize hormones. And these days, for better or for worse, I think for worse, younger guys are asking about and using testosterone replacement therapy, so-called TRT. And I just want to frame this up by saying there is no strict cutoff for what is TRT. There are plenty of people whose blood levels of testosterone and estrogen are within the normal reference range and decide to start doing these things. Of course, they can limit fertility. There are a bunch of issues, even at non-quote-unquote steroidal performance-enhancing dosages. I'd love to frame this up by first defining our terms, because one of the challenges on the internet is people talk about TRT, then they'll talk about performance-enhancing drugs, they'll talk about steroids. They're all steroids, right? I mean, testosterone and estrogen are both steroid hormones. But what one considered replacement therapy versus what one considers performance-enhancing is going to depend, right? So here's my question. Why in the world would any male in his teens or 20s or even 30s whose blood levels of testosterone and estrogen are at the appropriate levels, meaning within the normal reference range, why would they take exogenous testosterone, given all the negative effects on fertility, some of the challenges that it can present if the dosages aren't quite right, et cetera?